right, let me make sure we're. You know what? My face is a little flushed. Let's get So how y'all doing? I don't know if anyone saw the stream from earlier, but I'm gonna do a take two. I was having issues with the camera. I want to talk about. They just come up with some great, crazy names now. I mean, kind of lame names. Trump is, I mean, everything he does is great. They do, but he's got this new thing called the Great Healthcare Plan. So I'm going to touch on what started this whole thing, the whole ACA premium tax credits. Okay, so it's going to be this is going to be a complicated one to talk about. First of all, I'm not like a finance guy. I'm an engineer. I like messing with electronics, microcontrollers, and wires, and I like to build things with my hands. I do like to think. I like math. Okay, I'm not going to talk about myself. I'm going to talk about the ACA. Okay. So the best way to understand the general construction and architecture of the ACA subsidies, especially the tax credits, the premium tax credits that were really just for post-COVID, but in general, the ACAs in general were not that good. Okay, so they shut the government down because they wanted to extend the premium tax credits, but the ACA period, okay, let's say you want to get healthcare insurance, right? I'm going to try to simplify this down, and I'm going to give a scenario. And I'm hoping that when I say this scenario, we'll be able to talk a little bit about this, okay? So you want to get healthcare coverage. Now, normally, let's say this healthcare company has a premium, just a general base coverage, all the necessities, is $200 premium, $200 a month. Right? So it's a $200 a month premium. You want to get it. Now, what the ACA does is if you're in a certain bracket, you qualify for these tax credits. I think the best way to think of a tax credit is like it's a check that the government gives you and that it's cashable out to the healthcare insurance company. And then the healthcare insurance company cashes it and the government pays them. So here we go. You want to get this $200 premium for healthcare coverage, and so you go to the healthcare website and you qualify. You make between 100 to 400% the poverty rate. So you get tax credits, and you find out that your deductible and your premium cost are $0. It's free. You got nothing to worry about. Okay, that's so far so good. That sounds great. I'm for it. Okay, so now that you have this healthcare coverage, the healthcare insurer gets that $200 a month from the government. The government pays them on your behalf. Still good. Now, what just happened here? Why did they just take you so easily? Okay, now, if they want to get these tax credits, they actually can't judge you or judge your risk off of preconditioned medical issues. They can't factor in like you have a proclivity to have a certain type of disease. Maybe there's something in your family that's very hereditary, or you do things that increase your risks of having something. Like they're just, if you qualify for it, you get the insurance. So if you're a healthcare company and you want to get these tax credits, you have to accept people that qualify. You don't even weigh in the risk. That's it. I'm simplifying this. Of course, there's a little bit of risk, but I mean, it's true that 100% they can't do preconditioned medical issues. And actually, I agreed with that. When Obama did that, I was like, that's awesome. And he took smoking out of the mental hospitals. I was in and out of mental hospitals my whole life. And I've used Medicare, and I loved it. It's done me well. Because it's not, the problem isn't so much the coverage. Even though there are issues, there's trade-offs. but I'll get into what the big problem is with the ACA, because it's not necessarily the consumer, the citizen who needs health. And for most parts, 9 out of 10 times, they're taken care of because of this. They have coverage, and that's what we want. People deserve to have coverage. I don't know if I agree that it's a human right to have health care insurance. But I understand why someone would think that. I'm not there yet. I would love to be persuaded, but anyway, so okay, you got this $200 premium Medicare coverage, and now the health insurance company they had to override their typical risk assessment on you to give you that healthcare coverage. So what does that mean? What happens when a healthcare company ignores it's ignoring or overrides or pushes aside risk? What happens is the chances of claims go up. Right? If you're drunk and you drink and drive all the time, you're at risk to get into an accident, right? So now that probably allowed to factor in something like that. But overall, especially for the pre-existing medical condition, that's a big one. They can't weigh that in. So now what ends up doing, well, why would you do that? As an insurance company, why do you want to take on more people that have a higher risk of making claims? So therefore you have to spend more money on coverage. What are you trying to do? Go bankrupt? Trying to spend all your money saving the few people that have coverage, and then your business goes out? Because at the end of the day, healthcare insurers it's a business. Okay. So if you're the CFO, why are you doing this? Well, it's a volume calculation. What we want is, even though these are lower coverage thresholds, we get more. One, these people need coverage, and the only way they can get coverage is with tax credits, and there's only like 4 or 5 of us who accept the tax credits. So as long as we make these compromises to not weigh in pre-existing medical conditions, not being able to treat women different, which I'm fine with that, even though I do know that there's different categories of medical risks. So they want volume. That's their incentive. They want more people. At least that on the insurance side. The government wants voters happy. They want to give the voters whatever allows the people to like them, to vote for them again. Maybe a little bit of actually caring. I hope so. It doesn't seem like that anymore, but I hope so. And us, we go along with it because we're covered. Hooray! Good job. Good job, government. We have free health care. Well, hold on. At what cost? Okay? Because now I'm a healthcare company, right? I'm the CFO, and I'm noticing that risk is going through the roof, and I have even more insurers. So what I'm going to do is I'm going to have to increase the prices, subsidize the price of the individual marketplace premiums. So the people that aren't going through the tax credits, and maybe you say, oh, well, good, they have enough money, they let them pay more. Well, number one, that's, what if you were advancing through life and you got to that? You want to incentivize success. You don't want people to think, oh, when I make a certain amount of money, I'm going to just have all my money taken away. Okay. Now, I get it. I do think if you're more impoverished, lesser on the lower income brackets, you need a little bit of help. I'm okay with that. This is not my problem. But I want us to think about this, okay? Because here comes the big problem. Because their risk is so spread out, what they do is they limit their coverage networks. Now, this is what opens up the door. This is really the cause of so much problems. It's not the root cause, because the root cause is, as I'll explain, is just human nature. And this is the game board. So it eventually leads to corruption. So now we have to limit our coverage networks. We'll only cover these providers and these doctors. You have to go to one of them. Sorry. You can't just pick anyone you want. So you're like, okay, Evan, so what? Okay, I have a limited choice. Well, there's a broad, narrow restriction on the network's coverage that you can go to, the provider network. So these providers know that. they know you don't have many more options, and say you're in a certain area, like you may have no more options, you have to go to that place. Maybe they're the only place to take Medicare, or, have the certain, tool or imager or something. So that's where you get these bloated prices. They'll start charging you for crazy things. Because what happens when you want to go get an MRI? Do you ask them how much the MRI will cost? Not most people. Most people say, does my insurance cover? Does my insurance cover the MRI? Does my insurance cover this? Then they get to charge whatever the hell they want to the insurer. The insurer pays them because they're just going to get the money back from the government, and it's a cycle of corruption. So yeah, you may have free healthcare, but while you're lining the pockets of a very few healthcare providers and insurance companies. And that's not right. People are suffering and struggling right now, and they're not earning that money playing the game under a fair and level playing field. They're shaking the hand and lobbying government officials or congressmen to push these ACAs through, and a lot of us just go along with it. We say, well, as long as we have health care, I don't care, give them all that money. Do you? Do you not care? I care, because there just so happens that there is a brand new solution that's been pitched. And so overall, what I've described here is a very socialist system, right? It's a very government paid for, government regulated, telling the insurance company, who they can take and under what factors they can weigh into their risks and their costs, their premium costs. So it's very socialist. Okay, so now in Europe, they have a very similar thing. You get free healthcare, but you also get a higher tax pay. So we're just going to take the money over there. We're not taking the money here, but we'll take it from over there. And a lot of Europeans are fine with that. That's cool. But this is America, baby. We're capitalists, okay? We don't trust each other. We don't trust the government. We trust people's interests. We don't need to trust you that you're a kind person, but we need to trust that you'll do what's best for you. And what's best for you should be best for everyone around you. If not best, at least still good. If you start hurting people, people aren't going to like you. They're going to push you out, and that doesn't serve your interest. Unless you want to self-sabotage, you got to be a good enough person. Or good enough, whatever. You got to be good. You don't got to be the fucking saint, but... All right. Am I ranting too much off topic here? All right. So, have you ever heard of, yellow gold in the recovery community? Recovery centers or halfway houses, they'll charge $1,200 for a urine screen. That is ridiculous. It's fraud at its worst. It's fraud, and at its least, it's just crony, corrupt greed. That's not how much that costs. And we need a level playing field. So here's the solution by DJT. It's purely based off of capitalism. Let's go through the video. It's a 5-minute long video. Okay.
For all Americans, and truly make healthcare affordable again. We're doing things that
I need a bingo card when we
able
listen to Donald Trump.
We're calling it the Great Healthcare Plan. Instead of putting the needs of big corporations and special interests first, our plan finally puts you first and puts more money in your pocket. The government is going to pay the money directly to you. It goes to you, and then you take the money and buy your own health care. Nobody's ever heard of that before, and that's the way it is. The big insurance companies lose, and the people of our country win. This proposal locks in the massive discounts on prescription drugs that my administration is achieving through our most favored nation drug pricing agreement. Now,
yep. Look up what that is. Most favored nation agreement. That's already through. The rest of this plan has not gone through yet, so it's just theoretical, but man, it's a very unique and very novel solution that I've never heard of.
When you hear about that, for 40 years they've been trying to do it, but they never were able to do it. No other president was able to do it. I got every other country to approve it. by the use of tariffs and other things, they all approved it. Nobody else got it. No other president got it. And for the most part, they didn't.
I know a lot of you can't watch this without your blood boiling over with rage. So much vitriol and hate just for this man. But, is he braggadocious? Absolutely. Is he a little bit of, he different.
Even tried because.
But he's not lying.
They felt it was impossible. It'll bring down drug prices 80, 90%, in some cases, just numbers that nobody's ever heard of before. Your prescription drugs will come way, way down. And under this policy, the prices of many drugs will be slashed by 300, 400, and even 500% starting this month at the TrumpRx.gov. So instead of Americans paying the highest drug prices in the world, which we have for decades.
And know this, I have Medicare and I get my meds for free, but the way the system works is it's not for free. Those pharmaceutical companies are still getting that money just from the government. So the pharmaceutical company in Europe is going to give and distribute their drug to, say, like their local area at a loss, like cheaper than it costs to make the drug. They're fine with that. You know, you're like, what? Won't they go out of business? No, because they factor in the American market. Will they charge like 400 times the cost? Because the dumb Americans will pay for it. You know, and not anymore. Now we pay. Whoever pays the least, that's the price we pay.
We will now be paying the lowest cost paid by any other nation. So any other nation that's paying the lowest cost, that's what we're going to pay. And the American people will get the savings. So I have to reiterate, the lowest price in the world is what you're going to pay.
Can you give them that win, guys? You can't. Some of you can't. Your TDS will not. I mean, you're going to find a way to hate that.
Before you were paying the highest price in the world by far, and the politicians did nothing about it. So I'm asking Congress to complete the work that we've started. Next, my plan would reduce your insurance premiums by stopping government payoffs to big insurance companies and sending that money directly to the people. Obamacare was designed to make insurance companies rich. I call it the Unaffordable Care Act, with billions of dollars in taxpayer subsidies that...
It is. I mean, if you just look at your own coverage and the consumer side, everything's all hunky-dory. But you look at the money that's going to these healthcare companies, it's not... No. It's wrong. Don't just look the other way. We don't get to look the other way anymore.
Help their stock prices skyrocket over 1,700% as you paid more money for healthcare every single year, more and more. The premiums went higher and higher.
Because you don't got a choice. You got to get through them. You can't afford it, peasant. You got to get through these guys. And they know that. That's why that's why the ACAs exist. That's why they literally would shut the government down in order to fight for it. Because that's hundreds of billions of dollars, guys. Hundreds of billions of dollars. They'll shut the fucking government down. If they could, they'll shoot this dude. They'll kill somebody. Who knows who killed that United Healthcare guy? Maybe it was just that crazy guy, but, you know, it's a lot of freaking money. If I'm not mistaken, I think the healthcare industry is the number one, where is the most money, most expensive industry, most lucrative. I don't know how to say that. They have the most money in that industry. You know
want to end this flagrant scam and put extra money straight into the healthcare savings account in your name, and you go out and buy your own healthcare, and you'll make a great deal. You get better healthcare for less money.
You hear that? So that means you don't just get Medicare, and then you get who they dictate you get, and then you have to go within that network, their coverage network. No, what he's saying is, no, you get which is sort of similar to tax credits, because tax credits are sort of like given to you, and then you get but you don't really get a shop with it. You get a very selective choice. What he's saying is, no, this is not just for our lobbyist friends and our elite companies who we're going to give kickbacks to. No, what I'm going to do is give you this money, write a check to you, and you could go to any of these insurance companies that you want. And by the way, I'll also regulate these insurance companies so they have to tell you what everything costs. This is what the best part is, where they have to actually tell you, rather than just saying, hey, will my insurance cover this MRI? You could look at a sheet, like a menu. Oh, an MRI costs $400 here. Oh, this other hospital, it costs $500. I'm definitely getting one here. Or vice versa. It costs $200 down the road. I'm going there. That's how you introduce competition. Oh, they're selling it for $200? Oh, no, we'll do it for $199. Come here. Do you see how that will drive prices down through a capitalist system? It drives prices down. Don't just take a snapshot of the economy. You actually have to do some calculus and rates of change, and then factor in human behavior and how all the complexity evolves. Okay, this is genius. If you're capable of doing that, if you're capable of weighing in the advantages, disadvantages, in human nature and behavior, this is crazy. Crazy in such a good way. All right, get ready. This is where the best part comes.
That way you can choose the care that is right for your family. To further reduce insurance premiums, my plan ends the giant kickbacks to insurance brokers and corporate middlemen that only drive up the costs, and that's what they're intended to do, drive up the cost. But we're driving down the cost. And it fully funds a long neglected part of the law known as the Cost Sharing Reduction Program. This measure alone should cut premiums on the most popular Obamacare plans. It's hard to believe there are any, because it's a hated program, it's unaffordable, but it's going to cut them by an average of 10 to 15%. Next,
at first,
the Great Healthcare Plan. That's the name. It's called the Great Healthcare because it's great healthcare at a lower
genius
price.
Healthcare plan.
Mandates unprecedented accountability and transparency from insurance companies and all healthcare providers, so that special interests can no longer profiteer at your expense. As the saying goes, sunlight is the best disinfectant. That is why my plan orders all insurance companies to publish rate and coverage comparisons in very plain English. It requires insurers to publish detailed information about how much of your money they're going to be paying out in claims versus how much they're taking in.
Oh, I'll
in
just on the
profits.
screen.
In other
You don't
words,
gotta see it. It's just
you will
Donald
be
Trump
able
talking.
to watch the scam. It forces them to release detailed data on how many claims are being denied and whether those denials are eventually overturned on appeal. And most importantly, it will require any hospital or insurer who accepts Medicare or Medicaid to prominently post all prices at their place of business so that you are
That's
never
how you reduce
surprised
cost of
and you can
healthcare
easily shop
without being a
for
socialist.
better deal or better care, and you're going to end up doing both. You're going to get a better deal and better care. We will have maximum price transparency, and costs will come down incredibly.
Now, if this theoretical plan goes through, I mean, basic arithmetic, it's going to substantially reduce costs, but we have to see if that'll go through. I mean, when the government doesn't often pass common sense, simple solutions like this, but we did do no tax on tip, no tax on overtime. He doesn't get credit for any of that. But isn't that amazing? What do you think of that? Please comment below. Subscribe if you like this. I wanted to bring it to you. Hopefully, I'm autistic as shit. I'm not really a good public speaker, but that's sort of why I'm doing this, to push myself out of my comfort zone. And, maybe it'll make me be a better talker. I don't know. I don't know what I'm doing. But what I do know is I love this plan. I love you. And I love America. And I love God. And God loves me. And God loves you too. So with that, I'll let you go. Thank you for tuning in. Like, comment, subscribe, whatever you want to do, But if you do subscribe to me, I am so grateful and appreciative. All right, I love you. Have a great day. And until next time, this is Evan Levy, and this is the Lucid Observer. So have a great night.